following is a paid program. The medical information on this program is not to be used or relied on for any diagnostic or treatment purposes and should not be used as a substitute for professional diagnosis and treatment. This is St. Mary's Medical Center's Health Talk with your host, Kira Bresnahan.
Good morning and welcome to Health Talk. This morning we're learning more about the dedicated orthopedics unit and joint replacement surgery at St. Mary's Medical Center. In the United States, more than 1 million total hip and total knee replacement procedures are performed each year in the U.S., and around 450 of those are performed by Grand Junction orthopedic surgeon Dr. Jeffrey Nakano. He's in the studio today. Thanks so much for joining me, Dr. Nakano.
Thanks for having me.
Now, Dr. Nakano is the director of the Total Joint Program at St. Mary's Medical Center. We'll learn more about your work as an orthopedic surgeon in just a moment, but first we want to learn a little bit more about you and how long you've been the director of the Total Joint Program at the hospital.
Well, I've been the director ever since the program was started, which has been about 3 years now.
But you've been practicing in Grand Junction quite a bit longer than that, correct?
Yes, I would say so. Since 1983, actually.
Okay. Now, where did you relocate from to Grand Junction?
I was in Atlanta, Georgia, prior to moving to Grand Junction. That's where I did my training. That's where I actually grew up.
And tell us a little bit about your schooling, your background.
Well, as an orthopedic surgeon, you have to first go to college, and I went to Vanderbilt for a year, and then I went to Georgia Tech for 4 more years after that. I changed majors a couple times, and so it took me a little while to get through college, but I finally managed to do that. Then I went to Emory University Medical School, which is in Atlanta, Georgia, and then I did my orthopedics at Emory also.
So you took a little bit longer to figure out what you wanted to be when you grew up. Tell us about that aha moment in your life when you decided you wanted to become an orthopedic surgeon or a doctor.
Well, I'd have to admit, there probably wasn't exactly an aha moment. I was an architecture major through much of my college career. Actually, I did that for about 3.5 years. It's a 5-year program. It's a master's program. And after about 3.5 years, I realized that my skill set probably was not in architecture, that probably I was going to end up selling aluminum siding. And for that reason, I decided I better find something that I'm a little more attuned to. And I was always good at math and science, so I thought I'd apply to medical school.
And you're building joints, so that's part of architecture.
I would say there is a relationship there.
Now, why did you choose Grand Junction to practice?
I would have to blame my wife for that. Her parents lived in Farmington, New Mexico, and she wanted to move closer to her parents, but she didn't like the desert. And as a result, that kind of eliminated most of Arizona, New Mexico, Utah, and kind of left this corner of Colorado. She wanted to be close enough so that we could visit them on the weekends. And it turned out that there was an opportunity with the Hall brothers here in Grand Junction, and I took the job that they offered.
And now she realizes she lives in the desert, right?
It took a little while for her to realize that it's camouflaged by all the irrigation, but she does realize now that this is the desert, but she's happy here.
And your wife is also a doctor in town, correct?
That is correct. She's a pediatrician.
And tell us a little bit about your family.
We have 3 children. One of the reasons we moved to Grand Junction was because my wife wanted to move to a place where she thought that it would be safe to raise kids, and certainly we found that to be true about Grand Junction. We have one son, our oldest son, who has a developmental delay, and as a result, we're his guardians. We have 2 other children, a son who is currently in his neurology residency at Georgetown, and we have a daughter who's currently in her pediatrics residency, training to be a pediatrician.
Wow.
In Oakland.
Following in mom and dad's footsteps.
Yes,
Good.
Despite the fact that they had a very close view of the work style involved in those 2 areas, they were still willing to become doctors.
Now let's talk a little bit more about orthopedics now. We typically come and see you when our muscles and joints might be ailing us, right?
Correct.
Now, in the Grand Valley, do we have a higher rate of any certain type of ortho injuries? Like, what do you see more of as far as trauma cases?
Well, Grand Junction, St. Mary's Hospital in particular, is actually the second busiest trauma center in the state, despite the fact that we have a level 2 designation. In order to get a level 1 designation, you have to have in-house general surgery and some other prerequisites, which we do not have. But despite that, we are the second busiest trauma center in the state. There are several reasons for this. Number one, we're located on a major interstate, and unfortunately, a lot of accidents happen on that interstate, particularly in the area west of us. It seems that people have a tendency to fall asleep in the desert driving on that interstate, and we see a lot of trauma coming off I-70. As you know, there's a lot of outdoor activities in Grand Junction: skiing, bicycling, and those activities also create a lot of demand for orthopedic services with the injuries that occur with those activities.
Now, you still see those injuries in the ER for trauma cases, but 98% of your focus now is on joint replacement. When did your focus shift?
When I first started out in Grand Junction, I was a general orthopedic surgeon, did a little bit of everything. But it soon became apparent that Grand Junction was getting large enough to where we could attract subspecialists in orthopedics, people who did perhaps hand surgery or sports medicine or back surgery. And we made a special effort to try to recruit these people with this type of expertise. And when these people would consider our area, I would tell them that if they would come, I would stop doing what they happen to specialize in. And as a result, when the pediatric orthopedic surgeon came, I stopped doing pediatrics. When the hand surgeon came, I stopped doing hand work. When the sports medicine people came, I stopped doing anterior cruciate ligament reconstructions. When the foot and ankle person came in 2009, about the only thing left was artificial joints. So since 2009, all I've done is artificial joints, and as it turns out, that's been the most rewarding part of my career.
And St. Mary's does more artificial hips and knees than any other facility between Salt Lake and Denver. So right now, what types of joints can be replaced?
Well, in Grand Junction, we typically do hips and knees. Those knees more than hips, a ratio of about 2 to 1, which is what the ratio is across the country. We also do artificial shoulders, and there are different joints in the hand and wrist that can be replaced, elbow. We do not do artificial ankles at this point in time, though those certainly are available across the country.
Now, is the success rate better for, say, knees versus hips or hips versus knees?
I think that most statistics, and probably patients would attest to this, the success rate with hips is higher than the success rate with knees. I think it is because the complexity of the knee is much greater than the complexity of the hip. The hip is basically a ball and socket joint. The knee is often described as a hinge joint, but it's a very complex hinge joint.
Now, what are these artificial joints made of?
The artificial joints are made of typically a metallic component, can be cobalt chrome, can be titanium, and also a polyethylene component. And this is true whether you're talking hips or knees. With hips, the artificial ball is, it can be cobalt chrome or it can be ceramic. And I think you'd be interested to know that there is a company in town, Coors, that is producing ceramic balls these days.
Oh, wow.
They've just recently received permission from the FDA to start marketing them in the United States. Previously, they've only been marketing in Europe.
Now, how does an artificial joint compare to our natural joints?
Artificial joint is basically a resurfacing of the damaged joint surface. Sometimes people think that we're removing their entire knee joint, but what we're basically doing is just shaving off the portion of the bone that has been damaged, the joint surface. And we're replacing that joint surface with metal and plastic parts.
So let's talk about the best candidates for joint replacement surgery. What are some of the symptoms that someone might experience who is ready for a joint replacement?
Well, the the candidate for an artificial knee, for instance, is a person who typically is older. And you might say, well, why do you want an older patient? Well, an artificial joint is a mechanical device, and it's going to wear out over a period of time. And your best chance of success is with the first replacement. If you have to replace a joint replacement, it becomes increasingly difficult to produce a good result, and the risks are higher. So obviously you would like a patient to be older, so hopefully they will never have to have the joint replaced again.
Now, statistically, do men or women need or get more joint replacements?
Well, statistically, more joint replacements are done in women across the United States.
Why do our joints wear out faster?
I don't know that we know the answer to that question.
Are we tougher? Is that because we're tougher?
Or it could be that you do more work, and as a
okay, I'll
result,
take
the
that
joints
too.
wear out faster.
That
But
sounds
the
good.
candidate for an artificial joint is one who also demonstrates significant destruction of the joint surfaces from the arthritic process on X-ray. And finally, the patient has to feel that their symptoms are significant enough to warrant undertaking the risks of the surgery. And that's going to be different for everybody. So oftentimes the decision as to whether or not an artificial joint is done is more up to the patient than it is up to the doctor.
All right, well, we're going to take a quick commercial break. When we come back, we'll learn more about the orthopedic unit at St. Mary's Medical Center. We'll be right back with more of Health Talk.